We work with a lot of young professionals, and some of them are very interested in working in global health, considering going back to get a graduate degree. What degrees do you think are most valuable? Just an MPH, or are there other degrees out there that you think are really valuable for a global health career?
I think that MPH is obviously a fantastic and absolutely the right approach if you want to go into global health. There's also some Masters of Science programs that are also really great. It depends. Different schools have different kind of degree granting or types of degrees that they're going to grant. But so also thinking about whether you're looking for, kind of a focus on health, being a public health practitioner and really implementing programs, or if you want to get more experience and you really want to dive deep into program monitoring and evaluation and research. So the degree to which then you would need to also consider a PhD or a higher level degree is also something to keep in mind. And so it kind of depends on if you want to focus on at RTI, we have a pretty interesting mix. So we have a lot of people with PhDs, but we also have a lot of people with MPHs and with master's level degrees. And also there's, within the governance realm of health governance or health financing, you can also bring, an MBA or an MPA. It's a very global health, I would say, is not actually a particular discipline. I would actually say that global health is really more of a broad sector that's made up of a number of different disciplines that come together. So it really depends upon whether you're looking to implement a program and advise and be a public health practitioner, or whether you're looking at kind of pulling back and looking at the impact evaluations or monitoring and kind of research of those programs, or further the management and the structural issues that relate to the health sector. So it's kind of a weird field where you really can't go wrong. You just sort of need to know more about where do you see your core values coming into play, the skills and the things that actually excite you about working day to day, and then pursue a graduate degree based on that.
Great. And you as a recruiter personally focus on global health, though I think you probably get involved in all kinds of sectors. But where do you see the needs right now? What are the either sectoral, technical, functional areas that are most in demand? Or what are the positions that you find the hardest to fill?
Absolutely. I think it seems that kind of sector-wide, the push towards the emphasis on system strengthening, on capacity building is kind of reinvigorated. It's always sort of been there, but there's a growing focus on really making sure that the governance capacity as it relates to the health sector in particular, for my own personal focus, governance capacity and planning and management and accountability is really important. And finding individuals with that, potentially coupled with working in contexts where they've worked a lot on development of policies and for decentralization or devolution. And so kind of there are ways in which also people have, I think it's interesting and hard to find people who have crossed sectors in that way. So there's a little bit more of a blending of governance into health, or issues relating to health financing that also can apply towards workforce development and opportunities, and human resources for health. So the area of health system strengthening for health is definitely of growing emphasis, and funding, I would say, also from the donor sector, but one where it's sometimes difficult to find people who have the depth of technical expertise, particularly in the given geographical or country context that you're looking for. So I think the hardest position to fill is definitely around those areas. Also, there's a growing amount of focus on neglected tropical diseases, and for RTI at least, that's definitely also an area where we've been doing a lot of work and continue to see expansion and growth opportunities, and are excited about that. But along with that comes a need to find people who have done things from an integrated perspective. So a lot of programs over the last several decades, not just within neglected tropical diseases, but have been very disease specific and very kind of siloed in terms of looking just at trachoma, just at guinea worm. And from an eradication strategy that might make a lot of sense, but finding people who have been able to integrate that, or thinking about how to integrate some of those approaches, and ways in which you can bring an additional value to countries, ministries of health, programs in general, is sometimes tricky, but so it usually ends up being people who are getting a lot more on-the-job experience
right.
with an organization that's doing something where it's more integrated.
Right, right.